Hello everybody, welcome to this week's dental advice. Now when you come in for your checkup, we don't just examine your teeth, but also your soft tissues and your gums. This week I'm going to demonstrate to you how to maintain good gum health. Firstly, I'm going to use a model and a big toothbrush to demonstrate good toothbrushing technique. I'm going to use this rather large model of teeth to demonstrate how to maintain good gum health. When we're cleaning our teeth, we're trying to brush the sticky plaque away from the teeth. The plaque gathers in the gingival margin just here because it's a little groove that the bacteria can be protected by. So when we're cleaning our teeth, this is the spot to aim for. So when you're told to brush your teeth as well as your gums, it means either if you use a manual toothbrush, you need to start with the brush on the gum and pull it down the tooth, or with an electric toothbrush, make sure that it overlaps both the tooth and the gum margin. If you're using a manual toothbrush, then the best approach is to place the toothbrush bristles at an angle of 45 degrees to the tooth and then rotate it down. You need to do this about 5 times for each tooth surface. And then move round. And you'd move around the arch and then around the inside and then move to the other jaw. And as I do it on this lower jaw, you can see the bristles move in between the teeth. I tend to favour electric toothbrushes because they make life easy. I'm just going to change the model over now. I favour electric toothbrushes because it makes toothbrushing much more effective and simpler. All you have to do is hold the toothbrush bristles over the gum-tooth interface and slowly bring the bristle along the gum margin. So there's very little movement involved because the toothbrush itself will be rotating as it cleans. And you can see again the bristles get into between the teeth as you go around. And it would be the same pattern. You would move around the outside of the teeth and then around the inside until you reach the beginning again. Once you've completed the toothbrushing, we still haven't managed to completely clean the teeth because the areas in between the teeth still haven't been cleaned effectively. There'll be plaque in there, and if you don't remove it twice a day, you will get gum disease. In order to clean in between the teeth, there are various tools at our disposal. You can either use dental tape or floss that comes out of a box, or you can use dental floss or tape that has been put onto a plastic holder. If it comes from a box, you need to take a really good length of the tape and then start cleaning using one end of the tape, introduce it in between the teeth and out, and then you would move along the tape, going in between each contact with a fresh stretch of the tape so you're not introducing bacteria back in between the teeth. By the time you get to the end of the arch, you should be about halfway down the length of the tape. Then you can do the opposing arch with the clean stretch. This then has to be put into the bin. You shouldn't put it into the sewage system because it's really not very good for the fish in the ocean. I personally prefer using dental picks. Some people are concerned about them not being environmentally friendly, but you can use this dental pick over and over again until it is broken. When it is broken, all you have to do is cut the dental tape off and then take the plastic holder and put it in your recycling. So to use a dental pick, you need to squeeze the arms together. This opens this up and makes the tape really tight, and it's much easier to use if the tape is tight. You introduce it in between the back teeth and use a little horizontal movement. Start again on the very back contact, moving your way around systematically. So the approach is not to push down towards the gum like this, but to do a little horizontal wiggle. It doesn't need to be a big seesawing movement at all, just a small wiggle like this, and you'll feel it pops through where the teeth touch. Once you're through, you need to push the tape down against the side of the tooth, and you can see it bowing there as I'm pushing it against the tooth. And the tooth surface itself will guide the tape down and then back out again. And then you would do the same but on the adjacent tooth, and you can see the tape sliding right down there. Sometimes the tape will go slightly below the gum, and that's okay. And then out again, and you'd move round. Obviously, because it's a small stretch of tape, you need to keep rinsing the tape as you go round under the tap. So keep the tap running and take it out and give it a quick rinse and wipe as you progress round your mouth. If you see bleeding when you use dental tape or floss, don't be concerned that you've cut yourself. It is not possible to cut yourself with something like this. It's actually quite soft and gentle to the gum. If bleeding is seen, it's because you've touched inflamed gum, and any inflamed tissue will bleed on contact. So if you do see bleeding, don't stop, persevere, and in 5 days you'll find that the bleeding will stop because you've kept it nice and clean, and this has allowed your body to heal. If the gap between the teeth is quite large, which actually on this model it is, then an interproximal brush is more effective for cleaning instead of the dental floss or tape. This is a Wisdom interproximal brush. The heads are interchangeable. This one is a Teepee Brush. These are made in Sweden and they're very well designed. They're quite durable. If you use a Teepee brush, then the best approach is to bend the bristles to an angle of 45 degrees. It just makes the job a little bit easier. Your access is better. So when you use a Teepee brush, you take the brush and you introduce it in between the teeth on the horizontal. You don't push it through in one go, you just wiggle it backwards and forwards as if you're just exploring. And then as you do so, you'll find that the brush progresses through the space. If you try a single pushing movement, quite often the end of the brush will jam against one of the teeth and buckle. So a very, very gentle nudge. So it's almost like threading the eye of a needle. It's a very, very gentle approach. I always as well recommend to patients that you try and clean the space from both sides of the tooth. And that way you have really thorough cleaning in between the teeth. As I was saying, if you see bleeding when you're cleaning your teeth, don't panic. Just clean the area extra carefully, and after 5 days, you should find that it doesn't bleed anymore because it's healed. So take care of your gums and your teeth, brush and floss, or use the Teepee brushes twice a day, and we look forward to seeing you at your next appointment.